All right, let's talk about something that is, and I'm not exaggerating, a truly critical topic that could genuinely save limbs. If you're living with diabetes or you care about someone who is, what we're about to go through is so much more than just information. It's a toolkit for a healthier life. So, let's jump right in.
Just let that sink in for a second. Every 30 seconds. That's 2 people just in the time it took me to say that sentence. It's a massive, staggering crisis that's happening all around us every single day. But you know what? That's not even the most important number I'm going to share with you.
This is the number that changes everything. 80%. The vast majority of these life-altering surgeries are not inevitable. They almost always start with a small, manageable problem that, if you have the right knowledge, you can stop dead in its tracks. And that knowledge is exactly what we're here to build today.
So here's our game plan for this explainer. First, we'll unpack the silent threat, why diabetes puts your feet at risk. Then, we'll learn how to read the warning signs like a pro. We'll build what I call your 5-minute daily armor. We'll look at the right prevention toolkit, know exactly how to react in real time, and wrap it all up with the most important message: prevention is power.
So why the feet? Out of the whole body, why are they ground zero for one of the most serious complications of diabetes? Well, it all comes down to a devastating 1-2 punch that creates a perfect storm for injury.
Okay, so here's the double threat. First, you've got neuropathy, which is just a term for nerve damage. Think of it like this: the security alarm in your foot, the system that screams, "Ow, you stepped on something," or "Hey, this shoe is rubbing me raw." It gets turned off. You literally can't feel the injury happening. Then, at the exact same time, you've got the second threat, poor circulation, or PAD. Your arteries get narrower, which means less blood can get to your feet. So even when you do get a cut, the healing supplies, the blood, the oxygen, they can't get there to do their job. An injury you can't feel, plus a body that can't heal it, that is a recipe for disaster.
And look how fast it can spiral out of control. It all starts with something so small you'd normally just ignore it. Day 1, a tiny blister from a shoe that you don't even feel. By day 7, because you kept walking on it, it's become an open sore and ulcer. A couple of weeks later, because the circulation is bad, it's not healing, and infection starts to creep in. And just a month after that tiny blister, that infection could be in the bone, and suddenly amputation is on the table.
This is one of the most common and just heartbreaking things doctors hear from patients facing this reality. I didn't even feel it happen. That single sentence perfectly captures the silent threat we're up against. So if you can't rely on pain to be your warning system, what do you have left? You have your eyes.
All right, so let's get to work. Let's turn you into a detective for your own feet. By knowing exactly what to look for, you become the security alarm that your nerves might not be able to be anymore.
Okay, so every single day, here are the clues you're searching for. Some of it is about feeling, any new numbness, tingling, or burning. But a lot of it is just looking. Are there any weird color changes, red spots, pale spots? Is one foot swollen but the other isn't? Look for dry, cracked skin, because those cracks are like open doors for bacteria. You're on the hunt for anything that's new or different. Blisters, calluses, anything that looks off.
Now, listen up, because this slide is different. The last slide was about things to watch. This slide, these are red flags. This means you call your doctor today, not tomorrow, not "I'll see how it feels." If you have any open wound, any black tissue, red streaks spreading out, if the area feels hot or has a bad smell, these are signs of a serious infection. This is a medical emergency. You have to act fast.
Okay, so we know the risk and we know what to look for. Now for the most powerful part of this whole thing, the simple, proactive routine that will protect you. This is your daily armor.
I promise you, this whole thing takes less than 5 minutes. Step 1, inspect. Get a small mirror so you can see the bottoms of your feet. Check everywhere, especially between your toes. Step 2, wash and dry. Use warm water, please, not hot, and then dry them completely. Moisture trapped between the toes is a playground for fungus. Step 3, moisturize. Lotion on the tops and bottoms keeps skin from cracking, but, and this is a big one, never put lotion between your toes. Step 4, nail care. Cut them straight across, don't go too short, and just gently file the sharp edges. And 5, the big one, protect. Never ever go barefoot, not even for a second in the house. And always, always stick your hand inside your shoes before you put them on, just to make sure there's not a little pebble or a rough seam in there.
Let's just pause on that for a second, and I want you to be honest with yourself.
When was the last time you really looked at the bottoms of your feet? If you can't remember or it's been a while, that's okay. The best time to start is tonight.
That 5-minute routine is your absolute first line of defense, but it's not the only thing in your arsenal. Let's build out the rest of your prevention toolkit, which includes having the right gear and, just as importantly, the right professional team on your side.
All right, let's talk about shoes, because they are so much more important than you think. A proper diabetic shoe is special. First, it's got a seamless interior. No seams means nothing to rub against your skin and cause a blister. It's got extra depth, which gives your feet room if they swell or change shape. The cushioning is key. It's not just for comfort, it spreads out the pressure so you don't get sores on high-pressure spots. And maybe the most important rule, there is no break-in period. A diabetic shoe should feel perfectly comfortable the moment you put it on in the store. If it doesn't, it is the wrong shoe.
Your doctor also has tools to see what's going on with your circulation. A really common one is the ABI test. Now, this chart might look technical, but the test is super simple and painless. They just compare the blood pressure in your ankle to the pressure in your arm. All you need to know is that a lower number is an early warning sign of PAD, which means you and your doctor can get ahead of it. This isn't a scary test, it's just powerful information.
So here's the deal. You are the daily inspector, but your doctors are the professional managers of your foot health. And that professional care is absolutely non-negotiable. This means seeing a podiatrist, a foot doctor, regularly, and getting a full, comprehensive foot exam at least once a year. And please, no bathroom surgery. Don't try to cut out your own calluses or dig out an ingrown toenail. Let a professional handle that.
Okay, so let's imagine you're doing your daily check and you find something. A little cut, maybe a blister. What do? How you react in those first few hours can make all the difference in the world. So let's create an immediate action plan.
For a small, minor wound, the steps are pretty straightforward. Gently clean it with some soap and water, put a little antibiotic ointment on it, cover it up with a clean, sterile bandage. But here's the most important step. You have to watch it like a hawk. Check it every day. If it's not starting to look better in a day or two, you call your doctor. And if you see any of those red flags we talked about, redness, swelling, heat, you call them immediately.
I need to say this as clearly as I possibly can. The phrase, wait and see, is the most dangerous phrase in the world when it comes to diabetic foot care. With poor circulation, a tiny problem can explode into a limb-threatening infection with terrifying speed. We're not talking weeks, we're talking days, sometimes even hours. Hours matter. Always, always choose to be safe and get a professional to look at it. And that brings us to our final, and honestly, my favorite part of this whole discussion. We've gone over the risks, we've gone over the action plans, but it all comes back to this one central, empowering idea. You are in the driver's seat.
When you boil it all down, it comes down to these 3 pillars. Number 1, good glucose control. High blood sugar literally stops your body from healing itself. Number 2, the right footwear to protect you from getting hurt in the first place. And number 3, that 5-minute daily inspection. That's your early warning system. You do those 3 things consistently, and you have built a powerful shield around your feet. Prevention isn't just a hopeful idea, it's a strategy, and it absolutely works.
Look, building new habits is hard, but technology can be an incredible partner here. There are tools and apps like My Health Gheware that are designed to help with exactly this stuff. They can help you see how your glucose patterns are affecting your body's healing ability, and they can give you that simple daily nudge to do your foot check. It just helps make this life-saving routine a consistent part of your day. Let's end on this one simple thought. Your feet carry you through your entire life. Your mobility, your independence, it all rests on them. Taking 5 minutes a day to check them isn't a chore. It is an investment in your freedom and your future. Thank you so much for your time today. Now, go take a look at your feet.